With hip pain, I want to first start by having the patient lay face down on the table. I want to assess the level of functional short leg deficiency. I want to see if it's a left or right functional short leg. I then test the sacral area, and I want to see if the sacrum is rotated or torqued. I also want to check the front of the hip joint and the back of the hip joint. And so in combination, we calmly adjust the sacrum as well as the hip joints, and we're able to really help people who are having hip pain. On a side note, a lot of times when people do have hip pain, they are leaning forward in curvature. So oftentimes the hips are deteriorating, but we need to understand cause and effect. And the cause oftentimes with severe hip pain is the person's very driven and they over push and they push through fatigue, and the body starts going forward in curvature, and we see this in the side view full spine x-rays in both the standing and seated positions. In the worst cases of hip pain, the spine is further forward standing than when they sit, and so that's where we might put them in a cervical collar to try to slow down that head from going further and further forward, because we know the more forward that curve goes, the more the hips will have to lock to stabilize for the curve that is going forward.